Hello, welcome. Do you ever experience bloating, abdominal pain, constipation, diarrhea, or a combination of all of these, and all the tests are coming back normal? If so, you're not alone. Irritable bowel syndrome is one of the most common digestive disorders, and it can be confusing and frustrating. Today, I'm going to go over what IBS is, the symptoms, the tests, and the simple treatments that you can do to relieve your symptoms. I'm Dr. Darren, family medicine physician, so let's get into it. Irritable bowel syndrome, or IBS, is a functional GI disorder. The gut seems normal on all the tests, but the way that the gut is functioning is causing disruption in the form of chronic recurring symptoms. IBS is not cancer. It's not infection, it's not an inflammatory condition, but it can be very debilitating. The most common symptoms of IBS are bloating, abdominal pain, constipation, diarrhea, or a combination of these. These symptoms may alternate among one another, so you may have someone who experiences constipation, and then the next week they're experiencing diarrhea. These symptoms are often relieved by having a bowel movement. What are the most common triggers of symptoms in people with IBS? The most common foods that can trigger symptoms of IBS include highly processed foods, high-fat meals, alcohol, and caffeine. In addition, in many patients with IBS, their symptoms can be triggered by stress or anxiety. What are the most important tests that we use when diagnosing IBS? One of the frustrating things about IBS is that there is no test that can confirm a diagnosis of IBS. Rather, IBS is a diagnosis of exclusion. We order tests in order to rule out other causes. One of the tests that we order are laboratory studies, and this includes checking the blood, the urine, and the stool. We do this in order to look for evidence of other GI problems that could be causing the symptoms, such as infections, inflammatory conditions, or problems with individual organs, such as the liver, the gallbladder, or the pancreas. Imaging studies are very useful in the diagnosis of IBS. With imaging, such as a CT scan of the abdomen, we can visually inspect the large and small intestine, as well as the organs of the abdomen, to look for problems that could be causing the patient's symptoms. Depending on somebody's age and the severity of their symptoms, a colonoscopy may be done. With colonoscopy, we can visually inspect the inside of the lower GI tract in order to look for abnormalities. One of the advantages of colonoscopy is that if abnormal tissue is discovered, a biopsy can be taken, so we can find out what's causing the abnormal tissue. If somebody is experiencing chronic GI symptoms that we discussed earlier, and the laboratory studies are normal, the imaging studies are normal, and if a colonoscopy is done, that comes back normal as well, then this is consistent with a diagnosis of irritable bowel syndrome. There's no cure for IBS, but there are treatments that many patients can use to help to keep their symptoms under control. One of the best things to do if you have IBS is to create a food log. Take note of the different kinds of foods that you're eating, and also note the symptoms that you're having. In addition, take note of your mental state if you're experiencing any stress or anxiety. By taking down all this information in the food log, many patients are able to figure out triggers for their symptoms. And once we know the triggers, we can avoid those triggers in order to avoid episodes of IBS. Eating a bland diet can be an effective treatment for many patients with IBS, especially those who don't know what their triggers are. In addition, there are medicines that can be helpful to relieve the symptoms of IBS. If you're experiencing bloating, simethicone can be very useful to decrease the gas in your gut so that you'll have relief of your bloating. If you're having constipation, there are a variety of stool softeners available over the counter that can give you relief. such as Miralax. If you're experiencing diarrhea, Imodium is over the counter, and this can help to give you relief of your chronic recurring diarrhea. Remember to see your doctor right away if you experience fever, unexplained weight loss, blood in your stool, or if you develop any new GI symptoms and you're at least 50 years old. That's it for today. Thank you for watching. If you found this helpful, make sure to hit the like button and consider subscribing. Leave a comment below letting me know what topics you'd like covered in future videos, and let me know if you have any questions. Remember, these videos are for education purposes only. I can't give personalized medical advice here, so if you're having chronic recurring GI symptoms, make sure that you see your doctor. Bye-bye.